Getting the answers to some of the biggest COVID questions, from the new information we're learning about this pandemic to some of the misconceptions that are out there as well. Every Thursday, we talk to Dr. Ruth Berggren, infectious disease doctor with the Long School of Medicine at UT Health San Antonio. Doctor, thanks for being with us as always. We're learning more about the spread of COVID in terms of the aerosol spread versus droplets. Can you tell us what's changed in that information, and also the difference between the two, the difference between aerosol spread and droplets?
So it has to do with the size of the particle that your infectious virus is traveling in. And, if it's in a larger water droplet, that is droplet spread, droplet transmission. And if it's in a tiny, tiny dried out droplet, it becomes airborne. It's smaller, it weighs less, so it can float around in the air for a longer period of time. Now, the truth is, there's not just a line that divides between one form or the other of transmission. It's a spectrum, right? It's a continuous gradient. And what we're learning, though, is over time, we're seeing more instances where the virus must have been lingering in the air for a period of time in order to understand how somebody got infected. And so gradually we're seeing more information in the literature. We're seeing more presentations by scientists who study these sorts of things, affirming that it's not just simple respiratory droplet transmission, that there is some evidence that smaller particles do form from people sneezing, for instance, or coughing, or having a procedure done on their throats. And in these circumstances, the smaller little droplets can dry out and the virus can float around for longer. Now, it's not as infectious as some airborne pathogens like the measles, not nearly as infectious as that, but it tells us that we have to pay attention to air circulation and air quality. And outdoor air is better than indoor air, and more circulation is better.
It doesn't change masking, though, or social distancing, or washing your hands. It doesn't change any of that.
It changes none of those things. It just sensitizes us even more to something we have been talking about all along, which is to make sure that you have proper air exchange in a room, particularly if you're going to use a room for a large number of people. You want to make sure there's good air exchange, and you want to use the best possible air filters. And some of the very best air filters are more expensive, but they can actually cut out some of the droplets and some of the virions.
So when it comes to spread, have we ruled out the virus living on surfaces? Because, it wasn't that long ago that we were all disinfecting our groceries before we brought them into the house. So is that something that's pretty minimal at this point?
It certainly, the virus certainly survives on surfaces, and that is a mode of transmission, but it's not the biggest one. And the biggest one seems to be, the stuff we've just been talking about, and people getting too close to each other without masks on for too long a period of time. But I want to say something in favor of hand washing, since you brought up the virus on surfaces, and the way we deal with that is by cleaning the surfaces and washing our hands. Today happens to be Global Hand Washing Day. How about that?
Wow.
And another piece of information that's important to know about is that we're starting to see at University Hospital an uptick in the number of positive tests for rhinovirus, which is the common cold-causing virus, from nasal samples from school-aged children. And I don't have all the statistics for you because they're not done yet, but it's normal to see an uptick in respiratory viruses around this time of year. Everyone hoped that because of all of the education that we've done about hand washing and everything else, that we wouldn't see as much of an uptake in respiratory viruses this time of year. But based on early data, we're seeing that uptick. And there were a bunch of kids who were testing positive for rhinovirus last week, and they came in to get tested. Why? Because they had symptoms that made everybody nervous that they might have COVID. So to summarize, it's Global Hand Washing Day, and people need to wash their hands. And we know that it's especially important to remind the community about this because we're seeing increase in colds. And part of the way that's transmitted is from hands touching dirty surfaces or hands touching noses and then touching other people.
I'm glad you brought that up because I'm going to go to Hallmark and see if I can find a card for National Hand Washing Day out there.
Yep, please. I want my card.
All right, I'll see what I can do. We're running out of time. I want to talk about a lot of different things. Luckily, we've got you coming back on the night because I want to talk about reinfection, immunization, and we have a viewer question about the flu. So we're going to talk about all those things coming up tonight on the Night Beat. Dr. Ruth Berggren with the UT Health San Antonio, thanks a lot for your time as always.
Wash
those hands. Gotcha.
Global hand washing 7 months. We'll be right back.